and welcome to Population Health Plugin, a show highlighting current public health topics in our community. My name's Alana Kidd, and I'm an internship coordinator in the UAB School of Public Health. Today we have with us Regina Knox, Executive Director of the West Central Alabama AHEC, and Hannah Kraft, an MPH candidate student in the UAB School of Public Health and the Healthcare Organization Policy track. Thank you guys so much for being here today and taking the time to talk about the West Central Alabama AHEC and what you did for your internship. And I guess to just get us started, I know public health loves their acronyms. Yes. What does AHEC stand for?
AHEC stands for the Area Health Education Center.
And what do you guys do at the West Central AHEC?
Well, we're actually a national organization. In the state of Alabama, there's actually 5 regional AHECs, and we are all nonprofit, community-based organizations who work with rural and underserved communities to increase access to health care.
And what region of Alabama do you cover?
We cover West Central Alabama, which includes 13 counties and a large portion of the Alabama Black Belt.
Okay, and what sorts of programs, activities do you guys sponsor or provide as part of the AHEC?
Well, we have 3 core programs. We implement programs for health profession students. We call them community-based student education programs. And we really want to get students out into the rural communities. As you're well aware, Alabama has a severe shortage of mental health care professionals, primary care healthcare professionals, and dental professionals. So what we want to do is work with rural communities to recruit students that come from rural and underserved areas to get trained in programs like at UAB and to hopefully come back and work in their community or similar communities when they graduate.
And how many students do you guys reach normally a year?
Normally, on average, we're reaching about 20 to 30 students.
That's great.
In our community-based health education program. But we also have 2 other programs.
Oh, wow.
And so at the beginning of the pipeline, we call it a health education pipeline. We also work with high school students to expose them to different types of healthcare professions. So typically when we go to a high school and we talk about healthcare careers, everyone wants to be a doctor or a nurse. They don't know
They don't think about the other things.
Absolutely. So we implement programs to help educate them about the wide variety of health careers. And then we do a summer camp to further expose them to different healthcare occupations that they could consider as a career choice.
But that's not the only thing you guys do.
No, we do lots of different programs. And then our 3rd core program is that we want to support existing healthcare providers in those rural communities. Typically, there's only between 1 and 3 healthcare providers, particularly physicians in our rural communities. So what we want to do is provide them with continuing education to help them improve patient care. Typically, it's free online, but we do provide in-person continuing education programs as well.
So those programs are just like best practices and just new updates on things that they might not have access to go to the trainings, or they might not be able to learn much about the topics, but you provide that sort of.
Yes, absolutely. For example, right now we're doing an HPV promotion to increase the vaccination rate for youth ages 11 and 12. We work a lot with diabetes. We're currently working with the Alabama Department of Public Health and a small rural hospital to get them certified through the American Diabetes Association as a provider, an education provider. So patients can go to that hospital
and learn more.
They can participate in 10 sessions, which of course has been shown to improve their ability to manage their own conditions.
Wow. Well, it sounds like you have a lot going on.
We do.
And it's always great when you can get some help.
Yes.
And I understand you had some help this summer.
Yes, we did. We had Hannah Kraft. She interned with us for 6 weeks. And I would like to say that Hannah was very bold. We wanted her to come down and actually live in Greensboro, Alabama for 6 weeks. So she said, sure, I can do that. Greensboro is very small. It's about 3,000 people. The whole county has a population of less than 20,000. So very rural. So I hope her experience was a wonderful one. She got to work with a lot of diverse populations and work on some really cool projects.
Probably populations you haven't gotten a chance to work in before.
Right, yeah. It was a really cool experience.
And so what did you do for your internship out there?
So I had 3 main projects that I worked on. The largest one was creating a community resource guide for Hale County. So that's basically an exhaustive list of resources and services that people can use, like healthcare clinics and nonprofits and government services on a local and state level, things like that. So by creating a list like that, it was easy to access. People could find resources that they might not know about before. And I helped with the HPV seminars, so providing continuing education for primary care providers and helping to teach them sort of how to recommend that HPV vaccine and talk to parents about it and what age to recommend it at and things like that. And my third project was I helped out with the Dixie Nerd summer camp that we did.
That must have been fun.
It was awesome. So we took a group of more than 30 high schoolers out to a college campus, and we just stayed there for 5 days and introduced them to this range of healthcare professions. And we had guest speakers come and tell them about their career and their profession and like how to get there. And they got to do all these activities that were really exciting. They got to dissect a pig heart and learn how to suture. And just, they loved it. It was so cool.
And you had folks from public health there too, didn't you?
Yes, we did. From the UAB School of Public Health, they came out and talked to the kids about occupational health and safety and epidemiology and did some activities with them.
That sounds like fun. So that was 30 students?
Yes.
For 5 days.
Yeah.
Exhausted.
Really great.
Yeah, that's great. And then was there any specific situation or event that stood out with you during your internship that you'll always take with you going forward?
Yeah, so I really learned a lot about rural health, especially from a public health standpoint. And there's a lot of work that can be done in rural health, and there's a lot of need in terms of access to health care and education about living in a healthy lifestyle and just learning about the challenges of that in a rural area, something I hadn't been exposed to before that it was really eye-opening to see.
What impact do you think that had on the long-term or short-term public health of the community that you were in?
Yeah, that was really cool because I did a couple different projects and they each had really unique impacts on the community. So with the resource guide for Hale County, just providing that list and linking people to healthcare clinics, but also services like food banks and food assistance programs and housing assistance. That was a very real link to help people find the resources they need. And then more of a long-term viewpoint with the summer camp that we did, just introducing these students to professions that they didn't know existed before and letting them really see what it was like to go to college and to live on a college campus, I think was really eye-opening for a lot of the students, and they really were excited to get to do some of the things that they got to do.
And it's give them something to look forward to, like, this is all obtainable, this is within my reach.
Yeah, and just being
motivate them.
Being able to teach them about, like, how do you apply for college and how, like, what challenges are you going to face? Being able to mentor them in that was really cool.
Yeah. Well, that all sounds wonderful. And what other events do you have coming up with the West Central Alabama AHEC? And how can people get more involved with your organization if they want to get involved?
Well, we have 2 events coming up. We are partnering with the Tuscaloosa VA Medical Center to implement a Veterans Mental Health Summit on August the 25th. And individuals can contact me directly at our website, www.wcaahec.org. I know that's long, but all the information is on there, our contact information for our staff. And then we're actually looking for other interns. So we have a Delta Corps position available, which works with community members to implement the Walk with Ease program. So it's an evidence-based program created by the Osteoarthritis Foundation to improve mobility for older adults. So we always have opportunities available. We're always looking for interns. And just like the project that Hannah worked on, the Community Resource Guide was used as a basis to create an electronic and a printed guide that will be turned into a mobile app for Hale County residents.
And are you hoping to do that same guide for other counties in your area as well?
Yes, we are. Yes.
Another good project for a student.
Yes.
Yeah.
Well, thank you guys so much for being here. It was great learning more about what our partners are doing in the community to improve public health and what our interns and how our interns are getting involved. And thank you so much for joining us. Please tune in next time for the next episode of Population Health Plugin.